The Democratic Republic of Congo finally received its first delivery of vaccines for Mpox today, but it comes nearly a month after the World Health Organization declared the outbreak a public health emergency of international concern. William Brangham has more on the outbreak and the response.
The WHO has finally changed its approach so that those Mpox vaccines can be delivered and administered in Congo and across Africa. But those countries say the WHO has been too slow. The DRC first asked for vaccines 2 years ago amid a different outbreak. Mpox has infected an estimated 18,000 people and killed more than 600 in the DRC alone. Joining me to discuss the challenges of getting care there is Lawrence Gostin. He's professor of global health law at Georgetown University. Larry, great to have you back on the show.
Really happy to be with you, William.
Help us understand why this has all taken so long.
Yeah, well, let's just begin by just looking at a map. You see, on one map in Central Africa are all of the deaths, the suffering, the cases. Another map is where the vaccines are. That's in Japan, Europe, and the United States. And a lot of it is just pure greed. A lot of it is pure complacency. And then the other is that they really, even when the United States wanted to donate vaccines, they wouldn't take them because even though the US FDA had approved them, they weren't approved at WHO or in the DRC.
So greed, is there also some level of just a bureaucracy at work here that's complicating matters?
I think greed and complacency and bureaucracy would pretty much sum it up. Yes, I think a lot of bureaucracy. I mean, the main stumbling block is that the World Health Organization didn't give the vaccine emergency use listing, even though it was being...
Which would have freed it up.
Which would have freed it up. It would allow UNICEF and Gavi, the vaccine organizations, to actually deliver it and deliver it at speed. You still need the donations, though, because Africa can't make its own vaccine. And so Bavarian Nordic, a Danish company, has been charging a lot of money for it, making it unaffordable. The United States, even to this day, after the global emergency, has only delivered 10,000 doses to Nigeria. It's promised 50,000 to the Congo, which should be delivered on Saturday. But that pales in comparison to the 10 million that the Africa CDC say they need, and they need it urgently.
Right. How confident are you that that continued enormous flow will actually happen?
If history is any gauge, it'll be too little and too late. Because whenever we wait for vaccines, what Africa knows is that it never arrives on time and that it's insufficient quantity. So I think eventually it will. Maybe by the end of the year, we'll figure this out. But we'll have so many preventable deaths. With these vaccines, you can actually prevent the deaths, prevent the outbreak, and you can prevent it from coming to the United States, to Europe, and to other high-income countries. It's a win-win for everybody. Why don't we get our act together?
If somebody didn't know when they had just switched on this conversation, and they might think we were talking about COVID.
It's exactly what happens, and it happens with almost every global health emergency. We had the opportunity to deliver the vaccines a long time ago. We wait, we prevaricate, we have bureaucracy. And then you have enormous vaccine inequities. And, working with WHO and Africa CDC and the US government at the White House, I can't even express how much distrust and anger there is in Africa over this whole thing since COVID and now with Mpox.
The DRC and other countries are starting to get some of these vaccines. What do we know about their health infrastructure and their ability to deliver them and get people this protection?
It's a great question. I mean, it's weak. So what we need to do is not just deliver the doses of vaccines. We need trained health workers. We need testing, because the number of cases and deaths that you mentioned, William, are really just the tip of the iceberg, because we're not testing, we're not doing surveillance, we don't have labs, we don't have health workers, we don't have vaccinators. And so it's really top to bottom. We need to have kind of a health infrastructure that can deliver these vaccines, and the vaccines need to get there on time and into people's arms.
So, what can we, meaning the global north, the wealthier nations of the world, do to make this move faster?
Well, I think there are several things very, very clear. First, let's get the vaccines to where they're needed now. Let's invest in a real surge investment in the health infrastructure, the health system, the health workers, to actually get those vaccines delivered and protecting people. And ultimately, we're going to need to have Africa be self-reliant. They don't want to wait for charity. They want to be able to manufacture and deliver the vaccines themselves with strong health systems. We can do this if we only had the political will.
Larry Gostin of Georgetown University, always great to talk to you. Thank you.
Thank you, William.